Hello, everyone, and welcome to today's webinar, Group Therapy, Identifying and Working with Barriers to Healing from Sexual Abuse. My name is Clara, and I am a National Programs Officer here at Girls Action. In a couple of minutes, I will be passing the mic to Kim Melnyk from the Laurel Center. We are very fortunate to have her with us today. And I am happy to see some familiar names joining us for today's webinar. For those returning, welcome back. And for those of you who are new to our webinar series, I wanted to briefly introduce you to the Girls Action Foundation before passing things along to Kim. Very quickly, Girls Action Foundation is a national nonprofit that works to empower girls. We are based in Montreal, where we run local girls programs, and we work with some 300 partners across the country who run their own girls programs. We also provide leadership training, organize networking events, and do other things that connect girls and young women. And now I would just like to introduce you to our Building Bridges to Justice project. Dating and intimate relationships can be a significant part of many young women's lives. The Building Bridges to Justice project emerged from our national network. This community of practice is made up of facilitators and programmers who work directly with girls and young women. Consistently from coast to coast, violence is one of the biggest issues faced by the young women that they work with and for. The violence they are facing is systemic and daily and can take many forms. Dating violence or intimate partner violence was one of the specific forms of violence that many network members had observed young women facing. Through consultations with young women and other network members, it has been identified that young people often face barriers. They may not know how to access the justice system or how to access other systems of support. And available services and resources are often not adapted to young women's needs and realities. Network members indicated that community-based outreach and programming is a part of the solution to providing tools and systems of support to young women. Inclusive and supportive spaces can make a huge difference in the lives of young women confronting intimate partner violence. In response, the Building Bridges to Justice project was designed to address the needs of young women aged 16 to 24, as research shows that this age group is the most at risk for experiencing intimate partner violence. Oh, sorry everyone, that you couldn't see our slides. They will be visible in just a moment. Okay, so the Laurel Center is a project partner on the Building Bridges to Justice project. And before passing things along to Kim, I'd like to walk you through the interactive side of today's webinar. You'll see on your screen a number of different information displays and panels that will be changing throughout the presentation. On the right-hand side of your screen, you'll see a panel window titled Q&A. Here is where you can ask questions and interact with Kim, myself, and other participants. If you have a question or comment during the presentation, type it into the Q&A box, hit enter, and it will be recorded there. By default, the question will be visible to everyone. If you would prefer to submit your question privately, click on the down arrow at the bottom of the Q&A box and select Girls Action instead of all participants. The question will then come only to us. During Kim's presentation, she will be answering questions from the Q&A box, so feel free to ask your questions as they come. You don't have to save them until the end of the presentation. We will also be taking polls throughout the presentation. They won't take more than a couple of minutes. I wanted to let you know that today's webinar is being recorded, including the question period. This will be posted online, and we'll send everyone a link to the recording. Finally, at the end of the webinar, a survey will pop up. Please fill it out. We'd love to read your feedback. With that covered, I'd like to introduce Kim. Kim Melnyk is a case manager and facilitator at the Laurel Center. The Laurel Center provides direct services of individual and group therapy for women who have experienced childhood and/or adolescent sexual abuse. The Laurel Center provides information about the impact of abuse and understanding about the ways in which present lives are affected by the past. They encourage the sharing of experiences, feelings, and beliefs about abuse and help to identify the strengths that have assisted in survival. And now we'll pass things over to Kim.
Hello? Hello?
Hi.
Can you hear me?
Yes, we can hear you.
Okay, sorry. Hi, thank you. Thank you for having me here today. Are we going to finish the slides that you have for, or can I just move on to the slides that I have for the...
Yes, over to your slide.
Okay. Okay, so I made a little agenda as well. I'm just going to speak first to the title of the presentation. When we were talking about this, we were speaking from an intimate partner violence place, because that is a lot of the work that we did with the girls during the two sessions that we ran using the material from the Justice Project toolkit that was created with the help of everyone and Girls Action Foundation. So I do have a little agenda. I just kind of put in a little check-in, but that's sort of just to show you that that's what we do when we facilitate groups. We have an opportunity for people to check in and see how they're doing that day. So we have some context and what people are bringing and what they're hoping to have for their time participating in the group. So I'm also just going to go through what we do at the Laurel Center. All of you will know why girls programs are important, every single person. Just a little bit about recruiting, about how we let the girls and young women know about the space and ask them to participate. Just a little bit about creating space. I don't know if there's examples per se about exercises and the education, but this is the way we facilitate our groups, and I'm sure everybody participating today has experience with that, and please share your questions and answers. Just a little note about facilitating discussion when in group and promoting critical thinking, deepening learning, intense topics, and just a checkout and evaluation. And this is basically how every group that we run goes. We remind people about why we're here and want to hear from why people are attending our program. So we can move on to the next slide. So just as an example of a check-in that we might apply during a group, I'm actually using this check-in as a polling question. So where you have the polling on the side, you can please participate in that, because people come with all kinds of great ideas, and it's really good to hear some of those, because anything we can do to create a safe environment for the young women that we work with and for ourselves is wonderful, and just to hear what kind of people are attending today. What is your experience in running girls groups? So, do I open the polling now? Yeah. Open. Okay. So I've just opened the polling, I believe. So just to give you a bit of information about the Laurel Centre, we work with women who have experienced childhood and...
Kim,
Hello?
I don't think you actually shared the polling question with us yet.
I didn't? Oh,
If
I
you just
pressed...
click open poll.
I thought I did that. Is it there?
I don't think so yet.
The only option I have right now is close poll. Poll. It says poll in progress on my screen.
Okay. Okay, sorry about that.
That's okay. Thank you. So the Laurel Centre works with women who have experienced childhood and or adolescent sexual abuse. That's people come here, women come here, and they self-refer. So you don't have to be involved in the court process or be charging anybody, but you have to identify with having experienced childhood and or adolescent sexual abuse too. So that in itself is kind of, I would identify that as a barrier, that you are presenting with a trauma history when you access our services, and people are coming with a lot of I'll say issues around that, but more experiences, I'd say. We also have services for men. It's called the Men's Resource Center. It's part of the Laurel Center. They provide individual drop-in and group counseling, as well as workshops, and also provide therapy for men who have experienced childhood sexual abuse. So a lot of times we're asked, about services for men, and we provide those, but our space is exclusive to women and young women and sometimes girls, sometimes younger than 16. So this is our agency's mandate, and this is what the population we reach out to. The Laurel Centre assists women to understand the ways in which abuse has affected their lives. So that would involve learning about the impacts of trauma, and that incorporates all ways trauma can impact our lives socially and physically and emotionally, spiritually, all areas. We help identify and deal with the feelings related to the abuse, examine beliefs about abuse and about ourselves, about themselves that are attending the group, and to help alleviate some guilt and shame issues that people present with. Identify strengths and survival skills and to celebrate them. Identify self-defeating behaviors and to bring about change when women are ready for that. Develop and maintain healthy lifestyles, and to feel better about themselves and to develop a sense of dignity and self-worth. Our center does a lot of training and awareness. We run for service providers, just some special training around how trauma can impact women and I guess for the population that of men that attend the Men's Resource Center. But we do provide that training just around trauma, how it impacts us physically, how sometimes people aren't ready to do the kind of healing work they need to do until they've dealt with other things in their life that have brought them to a place where they can feel safe enough to be able to concentrate and do that hard work. It is therapy, and therapy is work. We work with adults age 25 and up in the individual long-term counseling, and we work with young women ages 16 to 24 in our individual long-term counseling. My co-facilitator in the group that we continuously run for the age group of 16 to 24 is Karen Wilson, and she's on some of the promo, and I'd just like to say that she is our only youth or young adult therapist here, and the girls and women that are attending our groups are specifically in her caseload. So they have a very trusting relationship with her, and I think that that's really helped us to be able to do some of this work in a group setting. We also have a couple counseling program that is only by referral, so you would be referred by your therapist when you were in the individual program. And we do have some of our young adults that do attend couple counseling that also are in our young women's groups. We have a short-term counseling program, so that's 6 sessions and it's goal-focused. Unfortunately, our waiting list is very long. It's 3 years for people attending the adult age 25 and up individual long-term counseling. So short-term counseling gives them an opportunity while they're on the wait list to access services for issues that are happening for them presently. We have adult groups, we have youth or young adult groups, we like to call them. We have a parenting group. We have capacity building workshops, which are a lot of the information in the capacity building workshop is around just coping with trauma symptoms. So we do a lot of active help practice strategies to actively keep ourselves safe physically and mentally when trauma symptoms are occurring. Things like night terrors or anxiety, general anxiety, strategies on how to manage those. We have an outreach program, and that's mostly about education and reaching out to people who could benefit from our services. And we have a follow-up program. So when people leave their term with us, which is up to 2 years, they can come back if things present themselves in their lives and they need some extra support. Now, that being said, our young women that we work with can leave the young adult program and go into the adult program. So potentially they can be with us for 4 years. Right. Having trouble getting the next slide here. Okay, so recruitment, we do a lot of networking. Well, I do. I'm the outreach worker and case manager here, so I do a lot of networking. I've been lucky to be able to do some of that networking with the Girls Action Foundation. Yay. We have some allies. One that I'd like to point out right now is we work with, well, we don't work directly with them, but there is this a really great healthcare facility service, community service in Winnipeg, and they're called Clinic, and spelled with a K, Clinic, and they focus a lot more on than we do on issues related to sexual assault and domestic violence. So we will make a lot of referrals to that organization because sometimes the work that is required for sexual assault as opposed to long-term sexual abuse is quite different. So it's really good to have them as allies and to be able to refer and vice versa. They refer to us. Partnerships, we, again, I guess the Men's Resource Center would be our main partner. I do a lot of outreach with community organizations like the Sexually Exploited Youth Coalition that we have in Winnipeg, and but official partners, I would say that would be it. So we can provide services to people who identify as men to have therapy for childhood sexual abuse. With the Men's Resource Center. I guess I have a little bullet here on creating space. We're always looking at creating safe spaces for people. A lot of the ways we do that is just around group guidelines and confidentiality policies that we have at the Laurel Center. For example, if somebody is coming for therapy, whether it's individually or in a group or even just to learn about our services with an orientation session, they will come to our agency. Sometimes someone will escort them. They might have a support person. That person is not not for confidentiality reasons, not allowed in our facility. So we just recommend that they can wait for the person or the woman who's attending here at the Laurel Centre. They can wait for her at a nearby designated area that's safe, and they can have access to the phone while they're attending programs here to phone and make sure that their ride is there. And that's just to ensure that everybody that comes into our building is safe, even from the stigma of who's here. They're here for treatment for childhood sexual abuse. So it's really important that their, brother's friend isn't here with someone else, and can right away identify them as fitting our mandate here. So that's one of the ways that we really work hard at making it a safe environment for people to attend our programs. And just thinking through theory of change, like some people may not be ready to give up some of the ways that they might cope with some of the trauma that they're experiencing. So for instance, it's not required that people abstain completely from using substances or other behaviors that they've identified as helping them to cope with some of the trauma that they've experienced. But we do try to help them devote their energy to participating in therapy when they are in groups and individual programs here by abstaining for a time period before and after, just so that they can give their energies and thoughts to what they're wanting to do for healing. So a lot of exercises we work, this will be no new news to Girls Action people, but some check-ins. We like to have like a bit of a fun question around check-in, like what is your favorite thing about spring coming, and or what food would you identify as being something that you like, or something you reminds you of someone or yourself. Icebreakers, there's a whole bunch of those on our Girls Action resource page that I'm always thankful for when facilitating groups. Energizers, same thing. We try to make it fun. The young women that come to our groups are always telling us that they have a lot of fun. They feel like they are in a space where they can laugh and connect with people that they do have a good time with here. So those kind of games or energizers and icebreakers are always welcome. And then we have a checkout. So that's really where women are able to identify how they're feeling when they're leaving, if they're feeling safe, and strategize what are some things they can do to stay safe until the next time we meet. What services can they access if they're feeling unsafe, they're feeling like they want to hurt themselves, or that they want to use substances, and that's something that they want to look at putting behind them. What are some strategies that they could do? So we focus a lot on, obviously, self-care, and also hearing from people what self-care means to them. Because a lot of times, I could say to somebody, oh, just go home and have a bubble bath. Well, that might not be self-care for someone. That actually might be triggering, having a bubble bath. So just to be mindful of those strategies may not fit for everyone. And a lot of times to facilitate discussion, we work with letting people warm up slowly. So a lot of times, especially when we come together for a first group, we might be wanting to pair people up and interview each other, like I'm going to interview my partner and I'm going to tell the group about her and vice versa. A lot of times we will give them the opportunity to begin individually. So maybe that person is okay with somebody else speaking on their behalf, but rather than just free speaking, to answer some specific questions might be more helpful, or actually giving some time to individually jot some things down about ourselves that we wouldn't mind sharing that with people. So just to always be mindful of different people's styles and what different people want to, how they want to be vulnerable, how if or at all, if they want to. And then as a whole group, there's a lot of, everybody knows about group dynamics. There's a lot of strong personalities in groups often, and sometimes we, for the sake of time or wanting to get through material, we might forget somebody who is, you know, sitting on the sidelines and maybe not participating. It's not apparent they're participating, but they are participating quite a bit, and to always be checking in with everyone and giving people the opportunities to explain how they feel they do communicate and they do what they get out of the group and what they maybe don't like, and how they can contribute. And we always use questions. We let people know that we're curious, and we want them to provide the answers from a place that is honest and from their experience. And so just some deepening the learning of those questions, like just asking people asking them, so what about that, and then, you know, maybe now what about that. We have a lot of intense topics that we go over during group, and I think just giving space to that, like being comfortable with it, or being willing to be uncomfortable with intense topics, and that we've been fortunate in being able to have spaces that allow people to discover these things as they come up, as they're happening. Sometimes we have people that are in the middle of crisis in their life, and they still make time to come to work. And then when you open up a group with something like a check-in, and somebody comes with, you know, a really big story about that is happening right now in their life, sometimes the whole group goes to that, and just really being mindful of everybody is participating and everybody is taking that in, and everybody is experiencing now one person's experience, and so just really checking in with everybody around what that means, how they're interpreting that, making sure that everybody's still feeling safe, because a lot of times some of the issues that are brought up can create uncertainty or feeling unsafe. For instance, if somebody's sharing their experience of having just had a weekend where they were binging or had a lot of substance use, or you know, violence was happening in their life, and they bring that to the group, and we have to manage that with every person, including ourselves. So just having those doors open to discuss that is crucial in working with the women that we work with. And then our sessions usually end with a checkout. It's quite lengthy, and a lot of times our programming is condensed, and this is where we try not to, but sometimes go over time, because we'll allow maybe 15 or 20 minutes for checkout. But if people are feeling unsafe, then we need to be prepared for them to be able to debrief and to assure us that they will be taking care of themselves, and if they can't, how we can assist them in ensuring that they're safe. Maybe they have to, we have to involve the mobile crisis unit, these kind of things if necessary, if somebody is really thinking of harming themselves. We do our checkout usually with, we call it F&Ps, so it's 1 feeling and 2 positives. So if somebody is, at the end of the session, is feeling, you know, scared, that might be their feeling, and then hopefully we can help them focus on 2 positives of, is that something related to them having some learning or having some growth now, or is this something happening, they're afraid of something happening to them. And then one of the positives is always that you are in this group and we can help you strategize and work with that and ensure that you're safe. And as always with every group, you know, the evaluation monster has to come. So we also try to make our evaluations fun, try to make them maybe really short so people will do them, maybe have a draw or prize for people who complete evaluations. And that's the way it goes. The things that we have in place for our the young women that attend the program is that they know that they will probably be having an individual session with their therapist, who is our co-facilitator. So that is, we're really fortunate, because I don't think we could do the extensive work, or intensive really, with the women if they didn't have that support. And myself, as the other co-facilitator, I am the case manager here at the Laurel Center, and one of my roles is to be able to provide support for any of the women that attend the Laurel Center if they don't have a therapist. Sometimes the young women that are on Karen's client load might want to work on something that isn't directly involved with their individual therapy. For instance, they might have a housing issue, or they might have a child care issue, something, and I would help them with that. Anything more basic needs or related or referral based, I would be the person to help them. So they have those resources, and I think that is a big part of them being able to share a lot of their experiences in the group, because they are feeling supported. There's a long-term relationship here. There's also the dynamic of having girls and young women at different stages. So for instance, we might have one 16-year-old, and we might have somebody who's 20, 24, 25, and who has taken some of the groups prior. So we have a bit of a peer learning component to our group because of that, which is just naturally occurring, and that is really great. So I guess I did have another polling question, right? I don't know. I'm not seeing it on my. Oh, the one poll has ended. Yeah. So I have to go to the other one, but I can't see that.
I think we can open it from our end.
Okay. So there's one more poll question, and
then we can share with you the answers from this second
okay,
as well as from the first polling question.
Oh, thank you. I can't really see anything on my screen for like questions and answers or anything. So and the polling thing it just says polling. It doesn't give me the.
Right. It's just been opened now. So
okay.
Are in the process of filling it out, and then we'll be able to share it back to you.
Oh, thank you. So yeah, if there are any questions, I don't see any on my screen, but if anybody wants to ask any questions, or if I need to explain anything that I rattled through there, that would also be helpful to know.
Maybe we'll just we can cover the polling questions and see
okay.
instead of that, and then we could move into
okay.
period. Yeah.
Can I answer?
Yeah.
Okay, I just...
a minute left there.
Okay.
Oh yeah, there's just about 10 seconds left for everyone
Okay.
to ask the full question now. And if people don't have enough time, you can always copy and paste the poll question and answer it in the Q&A box.
Okay.
Okay, so maybe we can go to the answers from the first polling question.
Okay. So how do I do that?
So, oh yeah. So for the first one, what have you done that you thought was helpful in creating safe spaces? We had one response from Wendy, who said that they do, in the program that she participates in and facilitates, they do a group process evaluation midpoint, or when necessary, that asks participants about their level of trust, and spend as much time as needed to develop the group agreements and design the agreements around values and virtues rather than traditional rules. And then we had one other response from Anna, who described creating clear group guidelines and to have a non-judgmental attitude among the group members and a supportive attitude.
Yeah, we do group rules or guidelines as well. I didn't cover that, but that is a really good way to hear from the group, and also giving up opportunity to maybe have a private spot to do that, like a suggestion box idea, but where you might want to incorporate into programming questions or issues space where it doesn't have to be identified who's bringing that forward necessarily, like, so that just to have that safety as well, like, can I make a suggestion, but it doesn't have to be attributed to me. It can just be a suggestion. I'd like to hear about why everybody thinks this is either a good suggestion or not so good, and that is a really good way to learn and assess the safety in the group too.
And do you have any, in discussing safe spaces, do you have any other tips for facilitators in approaching intense and potentially triggering conversations that are to be respectful of participants' different needs, as you described an open door there?
Right. Well, we have our thumbs up, thumbs down rule. I think a lot of people incorporate that into groups where people are free to come and go as they please and use the space, like how you don't have, for example, you don't have to like raise your hand and ask to leave the room to go to the washroom. You can go anytime you want, or get another beverage or whatever. But we need to know that you're leaving and you're feeling safe, that you just want some time to yourself, with a thumbs up. Or if you are feeling maybe a little activated, that you would indicate that by adjusting your thumb to midway or thumbs down. And because we always have two facilitators in the group, one of the facilitators would then leave the room with you and see what it is that you need and try to assist with that. So sometimes people might just have to leave, but it has to be assessed, are they okay to leave? Are they going to leave to go to an unsafe situation, or are they are they feeling okay with leaving and you know, just can't deal with this today kind of thing. So we have to also be contracting with people and making sure that they are, you know, okay to go, or sitting with them until they have those answers. You know, they're that's one way. We have a separate room because we're fortunate in that we have a group room where we facilitate our programming, and then we have a separate like accessibility room, so we can work with somebody briefly. One of the facilitators can leave the group and work with them briefly around what's going on for them, and almost everybody will take that opportunity or take that time for themselves. If it starts to be that every group they're needing individual time to get through the group, then we would also help them assess whether maybe it's not a good time for them to be participating in group, and then providing space or sessions to kind of get to a place that might be easier for them to participate in a group, or maybe groups just aren't for them, and that's okay too. But just it's all part of helping know what it is that we need, what it is that we're looking to gain from participating in services like during our healing journeys. So that's one thing. We also have food available, but at the same time we talk about people's food issues. So sometimes we want to sort of incorporate celebrating, and often that might mean gathering and preparing or eating food together, and sometimes that might mean not doing that, because there are people that really struggle with food in their healing. They might have an eating disorder or disordered eating. They might just have triggers around food. We had many years ago somebody who participated in our girls group who the smell of popcorn was really triggering for her, and she would have full-out panic attacks because part of her trauma history involved that as you know, as part of her abuse history, that there was popcorn, and that was something that she couldn't help it. Her brain was triggered. She would sometimes feel like she was back in danger. So you know, a lot of girls groups watch movies, we make popcorn, so that wasn't really you know, something that we would have thought of. But when you hear from the people that are attending, the young women will tell you, you know, this is something, and if they don't know, then they might experience it. At least they're experiencing it in a safe environment where we can help them manage it. So sharing those stories is really helpful in creating spaces, because people can identify with, oh, okay, that would be like something I struggle with. But you know, having the trust and the security that will be dealt with, and that your voice will be heard here is the main goal in being able to do the work.
Thank you. So we have the results from the second poll question, which was, what do you feel are the main barriers in accessing support services for young women?
Mm-hmm.
And we heard from participants the themes of shame and not knowing the resources that exist in their community, as well as the stigma associated with asking for help.
Yeah, that makes sense to me. That's what we hear from a lot of our. We have one young woman who is going to be a mom soon, and she had a job and she's going to university, and you know, it was recommended, well, why don't you apply for housing assistance? And it's just something she doesn't even want to explore, just based on, no, that's like her own thoughts around stigma are it's just not going to be something she's going to do. And knowing about the resources that are out for you involves also knowing what happens when you do approach these resources. So we do know that when somebody does apply for housing in our province and they're young and they may not have a rental history, they have to get reference letters. Well, how easy is it for somebody to go, you know, to their employer and say, you know, I'm a young woman and I'm going to have a baby, and you know, they're just very full of how is this happening to me, and now I'm having to tell this story over and over again to people just to be supported in my community. And I'm not saying there's an easy answer to that, but it just exists. So we have to maybe do some work and provide some support around, you know, what would make that easier for you to do? Would it be helpful if I helped you with that? Or, you know I write a lot of letters for people, but you know, if there's other service providers, because the other thing is that they have to be, their reference letters have to be on letterhead. So that would mean then that even if, you know, somebody has known you, like if you went to school and one of your teachers is like, oh yeah, I'll write you a reference letter, like how easy is it for a teacher to access the school or the school division's letterhead to be able to write you a personal reference? So it's not really a personal reference, it's more like a personal reference if you have the authority of an agency that's recognized by letterhead to be. So, you know, just little things like that where it would be a lot easier if somebody could say, well, you know, I need this help, and I know people have taken advantage, so-called advantage of the system, but right off the hop, I shouldn't be placed in the category of that assumption being made about me. So just a lot of work around having people knowing about their rights, having young women know that, you know, the assumptions and what people stereotype as being, you know, a single mom or whatever other kind of hurtful stereotypes are out there. Like we try to just really work with knowing what your rights are, knowing yourself, knowing what you can do and how you can have a healthier life.
So we have another question from Lorraine, and who asks, do you structure each group session around a particular topic that is predetermined, or is it based on what is coming up with group members?
That's a good question. We're in the, we like to hear from the young women who attend what it is they'd like to learn about. So, for instance, our next group that we're running, that begins in 3 Mondays, I believe, is on relationships. So the group, the young women have identified that they'd like to do some work around relationships. So our first session is on boundaries. So that is part of relationships. Our second session is on communication, and our third session is on assertiveness. That's all we have so far. But where that comes from is directly from the participants. So if they're saying this is something they want to look at, then when we're ending our last group, we'll say, okay, so what does that look like for you? Well, a lot of times people will say, well, I want to learn how to say no, or I want to learn how to say no without feeling bad. Well, then we just try to incorporate some information that will create those discussions. So, for instance, in the first session of being about boundaries, we our curriculum is about, identifying what are boundaries, what are healthy boundaries, and that's also from hearing from participants, what are healthy boundaries for you? How do we set those boundaries? And a lot of that comes from personal experience where, there might be people that are dealing with like visitation with their, like parenting rules. What are those boundaries like as opposed to maybe the boundaries you have with your friends, the people in this group? So really just that, providing that information and hearing from experiences and identifying examples of when the young women themselves have set boundaries, because a lot of times they're doing the work already, but they're just not identifying that they're doing that. But if somebody comes up to you on the bus and stands right beside you and you move away, well, you're asserting a boundary. You're keeping yourself safe. So doing these kind of things and really a lot of the and then we also have here, because my co-facilitator is so awesome, she has added conflict management and grief, loss, and forgiveness to the relationship curriculum. So based on what the members or what the participants are telling us, that's what we will create a group out of, and then really provide the material and hear from the participants about their experience in these topics. So I think a lot of people do work that way, but that's sort of the mindset of going into establishing what topics. With the toolkit, when we were working with the Girls Action toolkit and curriculum, everything was like it was awesome. It still is. We use a lot of the material still, but any of these those exercises can fit into these topics. So, for instance, I think in the group we have some stuff around consent, and we also have we're talking about assertiveness and discussing and brainstorming how to say no, and we're making a say no craft, and also some of the consent material from West Coast is really helpful in providing that material to be able to discuss and find out and hear from what people are finding helpful and what their experiences are in once they know that, and then applying it to their situations.
So, and we have a question from Wendy.
Hi, Wendy.
They are finding many gaps in services for transitioning youth, ages 17 to 24, and the adult services that are available in the community are very different from the youth services, and they are running a program for 16 to 24-year-old self-identified women, but are having difficulty getting the 19 to 24-year-olds because they are often already disconnected and isolated.
Mm-hmm.
And was wondering if you have any ideas about reaching that age group.
Mm. Wow.
We only have two minutes left for this.
Yeah, okay. Food? No. Bus tickets? I don't know. A lot of in that age group, I find initially I meet individually with them, usually off-site, and try to convince them that the needs that they're sharing with me that they're wanting to have met we are looking at that stuff in the group, and it does take a while. I have two young women right now that I'm working with, and they are in that age group. Wendy is 100% correct that it's a really difficult, and one of them is the girl I just spoke about who is looking to apply for housing, and she's just not in a place where she wants to be in a room with people right now. But from experience, continuing to just have that connection with them and then introduce them to the group by saying, you know, you might really benefit from this group because we are looking at exactly the issues you're wanting to work on. And then maybe saying, what would you like us to serve for snack that day? And just really trying to get them to participate by just continuing being there for them and being that trusting relationship that you can introduce them to the group through that. Sometimes it's helpful if they know somebody that's coming to the group, obviously, and then we just have to work with those dynamics when they're there. That's it.
Thank you for your presentation and
Thank you.
for bringing all of the questions and the discussion here today. And so we want to thank everyone who came and participated. And that's all the time we have for the presentation today. For those who would like to share this webinar with others, a link to the full presentation and question period will be available online in the next few days. And we will be sending you a link on where to find it. And we would also like to ask for your feedback on today's presentation. Once you leave this webinar, a pop-up window will appear with a very short survey. We would really appreciate if you take the time to fill it out. And this is a way to help us continue to improve the webinar experience for participants. And to find out more on this topic, you can check out our publications in our online resource center on our website, which is girlsactionfoundation.ca. And you can participate in more webinars and watch previous ones. You can also like us on Facebook and follow us on Twitter. And thank you all again. Thank you again, Kim.
Oh, thank you. Thanks.